Are you or someone you know suffering from ADHD, anxiety, or depression? Are you looking for alternative or complementary treatments to improve your quality of life? Hi, I'm Dr. Pamela Drury, and I'm here to tell you about a treatment known as neurofeedback. For most of us, let's just face it, our brains are not functioning as well as they could be. When brain dysfunction is severe, it can manifest in a number of serious conditions. In children, we often see problems such as ADHD, learning disabilities, or disorders on the autism spectrum. In people of all ages, we may see anxiety or depression. Or if someone has suffered a stroke or traumatic brain injury, their brain just can't function the way it used to. Even migraine headaches have been associated with dysfunctional brain activity. Neurofeedback is a technique that combines the latest science and technology to help you self-regulate and change your brain activity. With guidance from a trained neurotherapist, you can even learn to change those dysfunctional patterns that are associated with any of the clinical conditions I just mentioned. In fact, neurofeedback has been used successfully for many years to treat many different conditions, including ADHD, learning disabilities, autism, Asperger's syndrome, anxiety, depression, substance abuse, migraine headaches, chronic pain, and cognitive disorders associated with brain injury. Neurofeedback can even be beneficial to people with very healthy brains and who are quite successful. In fact, many elite athletes, performing artists, and business executives have used neurofeedback as a method for peak performance training. So how does neurofeedback work? The process consists of two phases, an assessment phase and a training phase. The assessment phase consists of a clinical interview in which a healthcare provider gets all your relevant information, a description of any problems you're having, and your goals for therapy. After this, the therapist obtains a quantitative EEG, also referred to as a QEEG or just a Q. First, a cap is placed comfortably on your head. Once the cap is on and connected, you are able to actually see your brain activity. You are then asked to sit quietly while the activity is being recorded. I analyze the recordings to see if any of your brain activity falls outside a normal range. If so, and if those findings are consistent with the problems you're reporting, then I create an individualized treatment plan with target zones of brain activity. The second phase consists of the actual training, where you learn to change and self-regulate your brain activity. Throughout the session, you will be provided information in real time about whether you are within the target zones or not. With just this feedback, you can eventually learn how to regulate your brain activity to keep it within the target zone. And now, here's the really fun part. During training, you don't have to worry about any of this. All you do is watch a movie on a TV screen or listen to music. As your brain activity drifts away from the target zone, the movie and sound will fade. And as your activity moves back into the target zone, the movie and sound come back. By practicing this process, you will be able to eventually work out how to stay in the target zone for longer and longer periods. And even better, when you're out in the real world and you need to be in that target zone, say to stay focused during class or to relax just before a big performance, your brain will now know exactly how to do that without you even thinking about it. Studies have even shown that these changes may remain years after completing the training. For example, this is a typical brain map of someone first coming in for neurotherapy. Areas that are green show activity that is within a normal range, but areas that are red show regions that have much more activity than a typical healthy brain. After neurofeedback training, we can see that all the excess activity has been reduced down to normal levels. Here is an example of the same patient who began with significant cognitive deficits. Many cognitive skills fell below the 10th percentile range. After neurofeedback training, those same skills improved to within the normal range. Here is another example of a patient who started with scores falling in the range of clinical anxiety and depression, who after a course of neurofeedback had scores that were completely normal. Here is an example of someone with ADHD, with scores improving from impaired to normal over the course of neurofeedback. So as you can see, over the course of neurofeedback, changes in the EEG correlate to changes in brain function. For several decades, people have been getting great results with neurofeedback. There are hundreds of scientific studies and years of clinical outcomes in the field that support neurofeedback as a very effective treatment for many different conditions. Within my clinic, I've seen time and time again that as people begin to self-regulate and change their brain activity, a broad range of symptoms begin to improve and their quality of life improves. So, are you ready to optimize your brain? If so, or if you just want some more information, give us a call and we'll be happy to meet with you to determine if neurofeedback is right for you and to answer any questions you have.